This is a brief presentation going over splenic torsion in the dog. So splenic torsion occurs when the spleen rotates around its pedicle. This causes a mechanical compression of the splenic veins and leads to vascular thrombosis, congestion, hemorrhage, and necrosis of the spleen. It's most typically seen in large breed deep-chested dogs, and the presenting signs really are nonspecific. You can see lethargy, vomiting, or anorexia. Splenic torsion can be isolated, or it can also be seen in association with GDV. In terms of imaging on radiographs, again, somewhat nonspecific signs. You'll see a large misshapen spleen or soft tissue opacity mass in the region of the spleen. This will often cause displacement of the GI tract, and you can also get loss of serosal detail secondary to either the enlarged spleen, abdominal effusion, or a combination of the two. On ultrasound, again, you'll see splenomegaly. You'll commonly see a diffusely hypoechoic spleen with linear hyperechoic lines. It's often called a lacy appearance. And this is secondary to splenic infarction and necrosis. Unfortunately, the spleen can also be normal in echogenicity. There will be decreased to absent blood flow on color Doppler, and the hyperechoic mesentery will also be seen adjacent to the spleen. So onto our case. Bear is a 6-year-old castrated male Labrador Retriever. History that was given when he presented to Tufts was that 4 days earlier he had multiple episodes of vomiting. The owner felt that he had improved the following day. And then 2 days earlier, he was slightly lethargic, and the owner noticed dark-colored urine. So she took him to the RDBM the day before presentation, and the RDBM took some radiographs. So this is a lateral radiograph taken by the referring vet. You can see this large soft tissue opacity structure in the cranial to mid-ventral abdomen. You also have displacement of the GI tract caudally, and then in this region you have loss of serosal detail. So again, this is just outlining our large soft tissue opacity mass, and given its location, it's most likely the spleen, but again, this is not pathognomonic for splenic torsion by any means. So this is a brief clip of a portion of the ultrasound. During the clip, you can occasionally look up in the top left and see where the probe is on the animal, and we'll go over some of the signs we see as we go through this. So as we start, we'll see our liver here to our left, and then as we work caudally, we see this large hypoechoic spleen with hyperechoic lines, that lacy appearance I was talking about, and really bright fat surrounding it. The spleen has kind of taken up the majority of what we can see in the abdomen. It almost looks like it's folded upon itself. You'll see kind of coming up in a minute some GI loops in the top right. That's just being displaced, and if you look closely, there is some effusion surrounding some of those loops as well. So we're moving further forward. We're going to put some color Doppler on in a second. We're now, if you look up here in the right cranial abdomen, and we still see spleen. So again, it's taken up the majority of this dog's abdomen. So we're going to put some color Doppler on, and we're going to see that there is just no flow going through. Here's a splenic vein coming through, and again, there's just no flow in that area, so there's no blood flow. In a second, we'll move up to the liver and put the color on that just to kind of prove that it's working and show the distinction between the two. So again, here's our liver, here's our color flow. You can see some nice normal blood flow in the liver. So if we move this over to the spleen, we're not really seeing anything. And then the final thing we'll see in a second, we're going to focus again on the splenic hilus and the splenic veins coming out into the mesentery, and you can see, you get the impression of some echogenic material within the splenic vein, and you get this hyperechoic fat that's continuous to the mesentery kind of coming up into the region of the spleen, and we'll go over that in 1 second. Okay, so moving on to the next slide, we get a panoramic image of the dog's abdomen using ultrasound, kind of give you an overview of what we were just going through. You see the liver up here cranially on the left side. Caudally at the right, you kind of see some intestinal loops being pushed out of the way, and the majority of the abdomen that we see here is encompassed by this lacy spleen with surrounding hyperechoic fat. Just briefly, we'll go over this image one more time that we saw at the end of the video loop. So we're at the hilus, and the splenic vein coming out has some echogenic material. There was some paper about 7 or 8 years ago that referred to this kind of hyperechoic triangle, and that's continuous to the mesentery in the region of the hilus. Some thought is maybe there's some mesentery being tracked up into the spleen as it rotates. And while this isn't a pathognomonic finding in splenic torsion, this in combination with other signs all kind of lead you to your high degree of suspicion of splenic torsion. And obviously in this case, this dog did have a splenic torsion, went to surgery and did well. So here are some references to some journal articles that go over splenic torsion, and of course you can go through some of the standard radiology textbooks as well, and they'll go over splenic torsion. So that's splenic torsion in the dog.